Usually when you hear the phrase DNA injection, your mind probably jumps straight to like some futuristic sci-fi movie.
Oh, absolutely.
Like you picture glowing vials, underground labs, maybe someone trying to splice themselves with a raptor or something.
Yeah, straight out of a comic book.
Exactly. But right now, today,
Yeah.
fragments of actual DNA are, they're the hottest commodity in the world of aesthetic medicine.
Yeah.
If you've looked into skin rejuvenation recently, you have definitely seen the names plastered everywhere. Rejurin, Plynist, Fillart.
Yeah, they're everywhere.
These are all brand names for a wildly popular treatment called polynucleotides.
And, we are looking at a massive, just fundamental shift in how we approach tissue repair. Because for a long time, the industry was focused on mechanically filling a wrinkle.
Right, like physically stuffing it.
Exactly. You have a gap, you put filler in it. But polynucleotides, they represent a move toward biologically reprogramming the skin to heal itself from the inside out.
Which sounds incredible on paper. But anyone who has even casually researched getting this treatment has inevitably stumbled across the horror stories about the pain.
Oh, the pain is, it's a major talking point.
People describe it as feeling like liquid fire going into the face.
Mm-hmm.
So that brings us to our mission for this deep dive. We are taking a massive stack of clinical injection protocol, South Korean pharmaceutical patents, aesthetic medicine reviews, and pharmacology textbooks.
A very dense stack, by the way.
Very dense, but we're using it to answer a highly technical but totally crucial question for anyone getting these treatments.
Yeah.
We need to know, what volume of localized nerve block anesthesia can you actually add to the syringe without diluting the active polynucleotide concentration?
It really is the defining dilemma for practitioners right now. To solve it, we have to look at the collision between advanced cellular biology and just practical everyday chemistry. Because you are constantly balancing patient comfort against chemical efficacy. And you cannot simply mix two liquids together in a syringe and, just hope for the best without understanding the molecular consequences.
So true. Okay, let's unpack this before we get into the pain management chemistry, because we need to establish what polynucleotides, or PNs, actually are. Looking through these clinical sources, it's clear they are entirely different from the traditional dermal fillers people are, used to getting in their cheeks or lips.
Right, totally different. The standard for dermal fillers for years has been hyaluronic acid, or HA.
Which is everywhere.
Everywhere. And if you have a deep nasolabial fold or, say, a hollow tear trough under your eye, HA acts like a physical sponge. You inject it, the molecule holds onto surrounding water, and it physically plumps up the empty space.
So it's like a structural intervention.
Exactly, it's architectural. But polynucleotides are high molecular weight DNA fragments. They do not plump.
And just to clarify where this DNA is coming from, because this is the part that always makes people do a double take.
Right.
It's fish, right? We are talking about injecting fish DNA into the human face.
We are. The DNA is typically derived from the gonads, specifically the sperm of salmon or freshwater trout.
Which sounds wild.
It sounds alarming at first, I know. But the manufacturing process is the key here. The clinical literature refers to a technology called PNHPT, which stands for highly purified technology.
Okay, highly purified.
Right. So the manufacturers extract the raw DNA and subject it to extremely high temperatures.
So they are essentially boiling away anything that could cause, like, an allergic reaction.
Now, that is exactly the goal, yeah. The purification strips away all the proteins, peptides, and potential allergens. What survives that process is a pure, completely biocompatible DNA polymer.
Wow.
And because the basic building blocks of DNA are universal across species, this purified polymer does not trigger an immune response when introduced into human tissue.
Okay, so if it's not acting as a physical sponge, like hyaluronic acid, what is this purified fish DNA actually doing once it gets injected into, say, a hollow under-eye area?
It acts as a biostimulator. It's essentially sending an instruction manual directly to your cells. When injected, these polynucleotides seek out and bind to specific cellular receptors in your skin.
And these are the CD44 receptors, right?
Yes, most notably the CD44 receptors. You can think of those receptors as locked docking stations on the surface of your cells.
And the DNA fragment is the specific key that fits the lock.
Exactly. Once that key turns in the lock, it sends a signal deep into the cell, which wakes up the fibroblasts.
Oh, I remember fibroblasts from our wound healing sources. They are basically the biological factories that pump out collagen and elastin.
They are the master builders of the skin. Activating them triggers a massive cascade of tissue regeneration. We see increased angiogenesis in the clinical trials, which is the creation of brand new blood vessels to supply oxygen to the tissue.
Which is huge for healing.
Huge. And we see profound repair of the extracellular matrix, which is the structural scaffolding that holds your skin together. It's actively reversing cellular damage. That's why it is becoming the gold standard for tricky, historically difficult to treat issues.
Like what?
Things like acne scars, dark under-eye circles, and creepy, thinned-out skin on the neck.
Okay, so the benefits are undeniable. But getting those DNA fragments into the skin is where the nightmare begins for the patient in the chair. The delivery problem is severe. We are talking about a thick, viscous gel that needs to be delivered into the superficial dermal layer, right?
Yes, very superficial.
And to do that, especially in incredibly delicate areas like right under the eye, practitioners use techniques called microdroplets or nappage.
Which involves using ultrafine needles, typically 30 gauge or 32 gauge.
So the needle itself is tiny, almost like an acupuncture needle.
Gentle, tiny, yeah.
But the technique requires multiple tiny injections, spaced just half a centimeter to a centimeter apart across the entire face. Like, you aren't getting one poke, you are getting 50 or 100.
Right. The practitioner is essentially creating a grid of microtraumas. The product has to be distributed evenly across a wide plane of tissue rather than deposited in one single lump.
And reading the aesthetic reviews in our sources, patients say it can be incredibly uncomfortable. It burns.
It really does.
The gel is thick, so it stretches the tissue as it goes in. So, the natural human reaction is to look at this and think, well, just numb it. I mean, it's like paying for a shot of really expensive top-shelf whiskey.
I like that analogy.
Right. Like, if it burns going down, the immediate instinct is to throw some water or a mixer in there to take the edge off. But doesn't watering it down ruin the whole point of paying for the good stuff? Like, why aren't manufacturers just pre-mixing lidocaine into every single PN syringe at the factory, the same way they do with almost every hyaluronic acid filler on the market?
That tension between comfort and efficacy is exactly what the pharmaceutical companies are wrestling with. To understand why it's not so simple, we have to pull from the South Korean patent data we gathered.
Oh, this is the KR patent, right?
Yes, specifically patent KR102348467B1.
Catchy name.
Very catchy. But South Korea is the global epicenter for this specific biotechnology, and this patent governs the manufacturing of DNA fraction fillers.
So I would assume the patent dictates a strict limit on what else can go into that syringe to keep the DNA stable.
It reveals a fascinating limitation, actually. If a manufacturer decides to mix an anesthetic like lidocaine directly into the polynucleotide syringe, the volume they are legally and chemically permitted to use is microscopic.
Really? How microscopic?
The strict sweet spot is between 0.2% and 0.4% weight per volume of the final product. Optimally, they aim for exactly 0.3%.
Wow, that is an insanely tiny margin of error. If hyaluronic acid fillers can handle a lot more lidocaine without falling apart, why is the limit so strict for polynucleotides?
Well, it comes down to two major issues. First is a pharmacological risk involving toxicity.
Okay, toxicity.
Yeah. Polynucleotides form a thick, slow-absorbing viscoelastic gel. If you inject a high concentration of lidocaine into a standard liquid, the body's blood flow clears that lidocaine away relatively quickly.
Makes sense.
But if you trap a high percentage of lidocaine inside a thick gel that is literally designed to sit in the tissue for weeks, the lidocaine can't escape. It creates what we call a depot effect, where the local tissue is bathed in the anesthetic for way too long.
Oh, wow.
And that prolonged exposure crosses the line from just numbing the tissue to actually risking local toxicity and nerve damage.
Okay, so a high dose of lidocaine trapped in a gel becomes a poison, essentially.
Exact.
But I'm guessing the second issue is about the aesthetics themselves. I mean, it's a closed environment. If you have a 2 milliliter syringe and you take up 10% of that space with lidocaine and other liquids, you are quite literally pushing out the active ingredient.
It is a zero-sum game. Any external liquid added to that syringe actively dilutes the polynucleotide concentration. The real-world evidence from our clinical sources highlights this exact trade-off. Take a wildly popular product like Rigerin HB+.
Right. HB stands for Hydro Booster.
Yes. The manufacturer deliberately adds lidocaine for comfort, and they also mix in non-cross-linked hyaluronic acid to give the patient an immediate boost of hydration.
And, I mean, On paper, that sounds incredibly appealing. You get less pain because of the lidocaine, and you don't walk out of the clinic looking completely battered because the hyaluronic acid plumps everything up immediately.
The immediate gratification is certainly higher. However, aesthetic insider sources and clinical practitioners are quick to point out the biological flaw here, especially for patients whose primary goal is tissue regeneration.
Because there's less room for the DNA.
Precisely. Because that syringe has a fixed volume, making room for the lidocaine and the hyaluronic acid means the patient receives a lower raw dose of pure DNA fragments per cubic centimeter.
You're literally watering down the expensive whiskey.
Yeah.
Like, you might get a temporary glow from the HA, but the long-term cellular repair, the whole reason you were stimulating those CD44 receptors in the first place, is compromised because you simply didn't deliver as much of the active material.
Which is precisely why we see a purist approach emerging in the premium market. Our sources point to European brands like Plynest and Chroma's Fillert line.
Right, I've seen those.
They deliberately formulate their core products with absolutely zero lidocaine.
They just refuse to compromise the math.
Plynest, for instance, is entirely focused on maximizing pure polynucleotide concentration. They pack 20 milligrams per milliliter of PN-HPT into the syringe. By keeping the lidocaine and the hyaluronic acid out, they guarantee maximum tolerability for sensitive tissue.
Because there's nothing else to react to.
Exactly. You completely remove the risk of chemical interference or an allergic reaction to the anesthetic itself while delivering a 100% pure regenerative dose.
Okay, but this leaves us staring right back at the poor patient sitting in the chair, dreading 100 fiery needle pokes to the under eye. We know the math now. Mixing anesthesia into the syringe dilutes the magic ingredient or risks toxicity. So how does a practitioner stop the pain without cheating the patient out of the biological results they paid, a lot of money for?
Well, the definitive answer to our core question, the exact volume of anesthesia you should add to the polynucleotide syringe to prevent dilution, is 0. You add absolutely nothing to the syringe.
We leave the syringe completely alone.
Completely alone. Instead, to achieve a totally painless procedure while maintaining 100% product purity, advanced practitioners bypass the syringe entirely. They rely on a completely separate medical procedure called a regional nerve block.
Okay, so instead of trying to put out the fire at the site of the injection, we go straight to the breaker box and shut off the wiring.
That's a great way to put it. Let's use the infraorbital nerve block as our primary example, since the under-eye tear trough is the most common and, frankly, most sensitive area for PN treatments.
Very sensitive, yeah.
The infraorbital nerve is a major sensory highway that exits the skull through a tiny hole just below the eye. It provides all the sensation to the lower eyelid, the side of the nose, and the upper lip.
So to shut off that highway, the practitioner takes a separate syringe filled with local anesthetic and targets the nerve root directly. Like, they can go in through the skin just below the eye, or even go up through the inside of the mouth into the inner cheek.
Yes. And because you are bathing the main nerve trunk in anesthetic, that entire quadrant of the face goes completely numb for anywhere from 30 minutes to 2 hours.
Wow.
But here is the brilliant part regarding our dilution dilemma. The anesthetic for the nerve block is placed deep in the tissue, resting right against the bone where the nerve exits the skull.
While the polynucleotide is injected superficially, just barely under the surface into the dermal layer.
Exactly. The two liquids never touch. There is absolutely zero dilution and zero chemical interaction. The skin receives the undiluted 20 milligram per milliliter dose of pure polynucleotides, and the patient feels absolutely nothing during those 50 or 100 micro-injections.
Oh, wait, here's where it gets really interesting, because I'm reading the pharmacology sources on local anesthetics, and there is a massive catch to this strategy.
Oh, yes, the pain of the block.
Right. Injecting lidocaine for a nerve block is famously painful in its own right. Anyone who's been to the dentist knows that the numbing shot sometimes hurts more than the actual procedure. It burns aggressively. So aren't we just trading one painful injection for another? Like, you're still torturing the patient before you even start the aesthetic treatment.
It's a very valid concern, and it brings us to a brilliant, elegant medical hack found in our compounding pharmacist sources. The reason a lidocaine injection stings so terribly comes down entirely to its chemistry. Plain, commercially available lidocaine is highly acidic.
So if it's burning human tissue on contact, I'm guessing plain lidocaine isn't sitting anywhere near a neutral pH.
No, not at all. It has a pH of about 6.3 to 6.4. The manufacturers are forced to keep it acidic, so the lidocaine molecule remains soluble in water and stays stable on the shelf for months.
Okay, that makes sense for storage.
Right. But human tissue sits at a neutral pH of about 7.4. When you forcefully inject a 6.3 acidic solution into a 7.4 neutral environment, it causes immediate cellular stress. And the brain interprets that stress as a sharp, fiery, burning sensation.
Okay, but how do you fix that without ruining the drug? Like, you can't just water down the lidocaine to dilute the acid, or you're right back to the dilution problem we had with the syringe in the first place.
You fix it through a chemical process called buffering. Immediately before the practitioner performs the nerve block, they drop the lidocaine and add a tiny mathematically precise amount of sodium bicarbonate.
Which is essentially medical-grade baking soda.
Chemically, yes it is. Sodium bicarbonate is a powerful base. When you mix it into the acidic lidocaine, it neutralizes it, instantly buffering the pH of the solution up from 6.3 to about 8.0.
But raising the pH doesn't just stop the stinging by neutralizing the acid, right? Because looking at the pharmacology, shifting the pH actually changes the physical shape of the drug itself.
It profoundly alters the molecular state of the lidocaine. Local anesthetics exist in two forms in a solution. There's an ionized, positively charged form, and a non-ionized, uncharged form known as the free base.
Okay.
When lidocaine is highly acidic, almost all of the molecules are ionized. They carry a positive charge.
And nerve cell membranes are lipid bilayers. They're essentially walls of fat.
Exactly. And a charged molecule has a tremendously difficult time crossing a lipid barrier. They repel each other. So when you inject plain acidic lidocaine, it just sits there in the extracellular space, causing a burning sensation while it slowly and, frankly, inefficiently struggles to penetrate the nerve cell.
So by adding the sodium bicarbonate and raising the pH to 8.0, you are essentially giving the lidocaine a VIP pass straight through the fat layer.
That's a perfect way to visualize it. By making the solution basic, you instantly convert about 50% of the lidocaine drug into that uncharged free base form. Because it no longer carries a charge, it becomes highly lipophilic. It loves fat. It rapidly and effortlessly diffuses right through the lipid bilayer of the nerve cell membrane.
That's amazing.
The clinical result is remarkable. The buffered solution is no longer acidic, so the burning sensation of the injection is completely eliminated. And because the free base lidocaine penetrates the nerve cell so rapidly, the onset of the total anesthesia happens in seconds rather than minutes.
So what does this all mean? Let's bring this deep dive directly back to the listener sitting in the chair. Say you've booked a polynucleotide treatment. You want to rebuild the collagen under your eyes, smooth out acne scars, or fix creepy skin. You want the maximum biological benefit, the full cellular repair, but you absolutely do not want to suffer through the pain. Based on everything we've synthesized today, what exactly should you be asking your provider for?
First and foremost, ask for a pure, unmixed polynucleotide product. Something like Plynest or Filart. Guarantee we're getting that full, undiluted 20 milligram concentration.
Don't settle for the watered-down stuff.
Right. Second, for the pain management, request that they handle it as a completely separate anatomical procedure. If you are getting a highly sensitive area treated, explicitly ask if they can perform a buffered infraorbital nerve block. That provides total numbness without ever compromising the integrity of the aesthetic product.
Okay, but what if someone is treating an area like the neck, where a single nerve block just can't cover a wide enough grid? Or what if they just have a severe phobia of the nerve block needle itself, even if it is completely painless because of the buffering?
That's very common. The clinical standard alternative we see in the sources is a high-quality topical numbing cream, but the application method is everything here. The gold standard is EMLA cream, which contains 2.5% lidocaine and 2.5% prilocaine.
Okay.
But you can't just wipe it on and hope for the best. The stratum corneum, the dead outer layer of your skin, is literally designed to keep foreign chemicals out.
Right, so if you just rub the cream on, most of it evaporates and the rest just sits on the dead skin cells doing nothing.
Exactly. The practitioner must apply a thick layer of the cream and cover it with an occlusive dressing, typically a plastic film, for a full 20 to 30 minutes before the procedure.
The plastic wrap traps the body heat and the moisture, essentially creating this microsauna that forces the numbing agents deeper into the dermis.
It bypasses the stratum corneum and penetrates into the active dermal layers, providing a very solid surface anesthesia. The microinjections become highly tolerable, and again, you never have to add a single drop of liquid to the polynucleotide syringe itself.
It really just goes to show how much intense biochemistry goes on behind the scenes of what looks like, a simple 15-minute cosmetic appointment. It means you don't have to choose between a painless treatment and an effective one. Keep the syringe pure, don't water down the DNA, and use a separate buffered nerve block or an occluded topical to handle the pain.
It is the perfect marriage of biology and chemistry. But, analyzing the pH buffering of lidocaine brings up a truly fascinating hypothetical when we look at the future of how we treat aging.
Ugh. Tell me more. We know from the clinical literature that the regenerative effects of polynucleotide injections aren't permanent. Like you get a massive boost, but it typically fades after 6 to 12 months. And that's because our bodies produce native tissue enzymes, specifically one called DNase.
Right.
And these enzymes naturally hunt down, break apart, and absorb these injected DNA fragments over time.
The body is just doing its job, cleaning up what it interprets as foreign cellular debris. But think about the mechanism we just explored with the anesthesia. We proved that we can radically manipulate how a molecule acts in the body simply by adding sodium bicarbonate to change the pH environment from acidic to basic.
Right. Shifting the pH fundamentally changed the entire behavior of the lidocaine.
And here is the provocation. Enzymes like DNase are incredibly sensitive to pH levels. They only function optimally within a very narrow, slightly acidic to neutral pH window. Wait a minute. If we just proved that we can hack a local anesthetic with baking soda to change how it interacts with our cells, could future skincare routines or complementary injectables intentionally alter our skin's localized pH to create a slightly basic environment?
Exactly.
Could we buffer our own skin to paralyze those DNase enzymes?
If you create an environment where the enzymes can't function, they can't break down the product, instead of the body chewing up the expensive salmon DNA in 6 months, you effectively hack your own biology to make these regenerative treatments last twice as long. If buffering works for comfort, why couldn't a different form of buffering work for longevity?
Wow, hacking the skin's microenvironment to freeze the degradation enzymes in their tracks. That is an incredible concept to leave on, and it really makes you wonder what the next generation of aesthetic science is going to unlock. Until then, just remember, keep your whiskey neat and keep your polynucleotides pure. Keep exploring the science behind the surface, and we'll catch you next time on The Deep Dive.